101. The chain of infection includes a reservoir, portal of exit, mode of transmission, and portal of entry. True or false? Answer: true. Rationale: these are critical links in the chain of infection and must be broken to prevent transmission. 102. A vaccine provides active immunity by stimulating antibody production. True or false? Answer: true. Rationale: vaccines introduce antigens that trigger the body's immune response and create memory cells for future protection. 103. N95 respirators are necessary when caring for a patient with measles. True or false? Answer: true. Rationale: measles is an airborne infection requiring airborne precautions, including an N95 respirator. 104. Infection control is only important in hospital settings. True or false? Answer: false. Rationale: infection control is essential in all healthcare settings, including outpatient, home care, and long-term care. 105. Respiratory hygiene includes covering the mouth and nose when coughing. True or false? Answer: true. Rationale: this practice helps prevent the spread of respiratory pathogens through droplets. 106. Candida albicans is an example of a viral infection. True or false? Answer: false. Rationale: Candida albicans is a fungus, not a virus, and can cause opportunistic infections like thrush. 107. A fomite is a type of vector that lives and transmits pathogens. True or false? Answer: false. Rationale: fomites are inanimate objects. Vectors are living organisms like insects. 108. Contact precautions require the use of a gown and gloves. True or false? Answer: true. Rationale: gown and gloves prevent the transmission of pathogens through direct or indirect contact. 109. Viral infections are effectively treated with antibiotics. True or false? Answer: false. Rationale: antibiotics treat bacterial infections. Antiviral drugs are needed for viruses. 110. Surgical asepsis refers to techniques that keep areas free of all microorganisms. True or false? Answer: true. Rationale: surgical asepsis or sterile technique eliminates all microbes to prevent infection during invasive procedures. 111. The CDC recommends standard precautions for all patient interactions, regardless of diagnosis. True or false? Answer: true. Rationale: standard precautions apply to all patients to prevent cross-contamination. 112. It is acceptable to reuse single-use gloves if they are not torn. True or false? Answer: false. Rationale: single-use gloves must be discarded after one use to prevent cross-contamination. 113. Hepatitis B can be transmitted via contaminated needles. True or false? Answer: true. Rationale: HBV is a blood-borne virus and can be spread through needle stick injuries. 114. It is unnecessary to clean non-critical medical equipment between patients. True or false? Answer: false. Rationale: all equipment must be cleaned between uses to prevent cross-contamination. 115. Alcohol-based rubs are ineffective against Clostridium difficile. True or false? Answer: true. Rationale: C. difficile spores are resistant to alcohol and require handwashing with soap and water. 116. Blood and all body fluids, except sweat, are considered potentially infectious. True or false? Answer: true. Rationale: according to standard precautions, all body fluids, except sweat, are treated as potentially infectious. 117. Removing gloves eliminates the need for hand hygiene. True or false? Answer: false. Rationale: hands may still be contaminated during glove removal. Hygiene is essential. 118. Patients on airborne precautions must be placed in a negative pressure room. True or false? Answer: true. Rationale: negative pressure rooms prevent airborne pathogens from escaping into other areas. 119. The portal of exit is the way a pathogen leaves the host. True or false? Answer: true. Rationale: this can occur through body fluids like saliva, blood, or respiratory droplets. 120. Infection control only involves nursing staff. True or false? Answer: false. Rationale: all healthcare personnel must adhere to infection control practices to ensure patient safety. 121. Airborne diseases can be transmitted by particles smaller than 5 microns. True or false? Answer: true. Rationale: airborne pathogens like tuberculosis are transmitted via droplet nuclei smaller than 5 microns that remain suspended in the air. 122. Hand hygiene is considered the single most effective method for preventing the spread of infection. True or false? Answer: true. Rationale: proper hand hygiene breaks the chain of infection and is the cornerstone of all infection control practices. 123. Personal protective equipment, PPE, includes a lab coat, sandals, and a stethoscope. True or false? Answer: false. Rationale: PPE includes gloves, gowns, masks, and eye protection. Lab coats and sandals do not meet PPE standards. 124. A patient with active tuberculosis should be placed on droplet precautions. True or false? Answer: false. Rationale: tuberculosis requires airborne precautions, not droplet, due to its transmission through small particles. 125. Antiseptics are used to disinfect surgical instruments. True or false? Answer: false. Rationale: antiseptics are for use on skin. Disinfectants are used for inanimate objects like surgical instruments. 126. MRSA, methicillin-resistant Staphylococcus aureus, is spread by contact. True or false? Answer: true. Rationale: MRSA is transmitted through direct or indirect contact, requiring contact precautions. 127. Isolation precautions are only required for patients with confirmed infections. True or false? Answer: false. Rationale: isolation may be implemented based on clinical suspicion while awaiting confirmation to prevent spread. 128. Immunocompromised patients are more susceptible to opportunistic infections. True or false? Answer: true. Rationale: their weakened immune systems cannot effectively fight off infections that are normally harmless. 129. Droplet precautions require a surgical mask within 3 feet of the patient. True or false? Answer: true. Rationale: droplets travel short distances, typically up to 3 feet, so a mask is needed within that range. 130. Sterile gloves are always required for standard precautions. True or false? Answer: false. Rationale: clean, non-sterile gloves are sufficient for most standard precautions unless performing sterile procedures. 131. Hepatitis C can be spread through casual contact such as hugging. True or false? Answer: false. Rationale: hepatitis C is bloodborne and not spread through casual contact. 132. Reverse isolation is used to protect the patient from others. True or false? Answer: true. Rationale: reverse isolation protects immunocompromised patients from being infected by healthcare staff or visitors. 133. Cough etiquette is part of standard precautions. True or false? Answer: true. Rationale: covering coughs and sneezes prevents droplet spread and is part of standard infection control. 134. All waste from an isolation room must be treated as regular trash. True or false? Answer: false. Rationale: waste from isolation rooms must be handled as biohazardous waste to prevent cross-contamination. 135. Infection can occur even if only one link in the chain of infection is present. True or false? Answer: false. Rationale: all links in the chain must be present for an infection to occur. Breaking any link interrupts transmission. 136. Healthcare-associated infections, HAIs, are often preventable. True or false? Answer: true. Rationale: many HAIs can be avoided through strict adherence to infection control practices and protocols. 137. Gloves should be worn when touching blood, body fluids, or contaminated surfaces. True or false? Answer: true. Rationale: gloves provide a barrier and protect both the healthcare worker and the patient. 138. Infection control protocols vary significantly between hospitals and clinics. True or false? Answer: false. Rationale: while implementation might vary, standard infection control guidelines like CDC and WHO are consistent across settings. 139. Only nurses are responsible for ensuring infection control compliance. True or false? Answer: false. Rationale: all healthcare staff share responsibility for maintaining infection control standards. 140. The presence of microorganisms always leads to infection. True or false? Answer: false. Rationale: many microorganisms are non-pathogenic and part of normal flora. Infection occurs when pathogens overcome the host's defenses. 141. Alcohol-based hand sanitizers are effective against most bacteria and viruses. True or false? Answer: true. Rationale: alcohol-based hand rubs effectively kill many common pathogens, including most bacteria and enveloped viruses. 142. Standard precautions apply only to patients with known infections. True or false? Answer: false. Rationale: standard precautions are applied to the care of all patients, regardless of suspected or confirmed infection status. 143. Surgical asepsis involves maintaining a sterile field and using sterile techniques. True or false? Answer: true. Rationale: surgical asepsis ensures that an area is free from all microorganisms, including spores. 144. The chain of infection includes reservoir, mode of transmission, and susceptible host. True or false? Answer: true. Rationale: these are 3 of the 6 links in the chain of infection, which also includes the infectious agent, portal of entry, and portal of exit. 145. Contact isolation requires a negative pressure room. True or false? Answer: false. Rationale: negative pressure rooms are required for airborne precautions, not for contact isolation. 146. All PPE should be removed before exiting a patient's room. True or false? Answer: true. Rationale: PPE should be removed before leaving the patient environment to prevent contamination of outside areas. 147. A sterile object remains sterile even if it touches a clean, non-sterile object. True or false? Answer: false. Rationale: contact with a non-sterile object contaminates a sterile object, violating aseptic technique. 148. Infection control practices are only necessary in hospitals. True or false? Answer: false. Rationale: infection control is essential in all healthcare settings, including clinics, long-term care, and home care. 149. The skin is considered the first line of defense against infection. True or false? Answer: true. Rationale: intact skin serves as a physical barrier preventing the entry of pathogens. 150. A patient with Clostridium difficile, C. diff, infection should be on airborne precautions. True or false? Answer: false. Rationale: C. diff requires contact precautions and hand washing with soap and water, as alcohol does not kill its spores.